In honor of Pet Cancer Awareness Month in November, and the fact that greater than 50% of dogs over the age of 10 die of cancer, as well as a significant number of cats, I thought I would bring up some aspects of conventional perspectives on cancer and more holistic perspectives on cancer. My name is Dr. Michael Dym, and I'm a holistic veterinarian here in West Palm Beach, Florida. I offer inpatient consultations to the clients in the South Florida area, and I offer phone consultations nationwide. Conventional medicine involves more early detection, early diagnosis, and early treatment, whereas holistic veterinary medicine is more involved with prevention of cancer in the first place. Now, cancer medicine has certainly evolved since the early 90s when I graduated from veterinary school. Improvements in diagnostics with digital x-rays, ultrasounds, CT scans, MRIs, and laparoscopic surgeries have come into play with picking up cancer early on. Improvements in treatment, such as improved surgical techniques, often involving laser, emerging chemotherapeutics, as well as radiation treatments, have certainly somewhat evolved over the past few decades. Also, stem cell therapies have come about, and there are certain cancer vaccines that are now available. There's a melanoma vaccine for malignant oral melanoma. There's actually now cancer vaccines that are derived from the patient's cancer cells. In other words, biopsy specimens are sent to a lab, and then a vaccine is developed from the patient's own cells. And that's a newer technique that still the results have to be determined. But the conventional colleagues are certainly excited about that one. Now, holistic medicine is involved with prevention. As I said, I can't stress that enough. And it starts when our animals are puppies and kittens. Decisions firstly made on vaccines are imperative to a healthy immune system in the days, weeks, and months ahead, years ahead during these earlier times. So we want to stress minimal vaccines to our young animals. And if vaccines are chosen, we want to use what are called monovalent vaccines. In other words, vaccines containing only one component versus multi-component vaccines, which really do a number on the immune system. And we want to make sure that we're vaccinating if we vaccinate animals, that we do so when they're not sick with something else. I can't tell you how many of my colleagues vaccinate young animals when they have respiratory or gastrointestinal issues. Even in the shelter environment, that practice is rampant. And when we do that, we damage the immune system. And that, again, affects the immune system in the months and years ahead. We also want to be mindful of species-appropriate raw meat diets. Those are the cornerstones of good health. As I've said many times, we want to say, let food be thy medicine, let medicine be thy food. And nothing is more important than that. So the groundwork of a good species-appropriate diet when our animals are young is the most important prevention that I can possibly recommend to my clients. We want to be mindful of sex hormone stresses on our animals. For example, early spaying and neutering significantly increases the incidence of certain cancers in our animals. Lymphoma, as well as bone cancer, hemangiosarcoma, a tumor of the blood vessels, all are increased when animals are neutered or spayed, especially when they're very, very young. Toxic flea and tick medications also come into play when we talk about cancer development, especially when these products are used month after month, year after year. They're toxic not only to the liver and the nervous system, but many of the ingredients in these products are also highly carcinogenic. So what do we do with holistic management of cancer if it does emerge? Well, I often start with nutritional supplements in certain animals. Often I'll use rotating probiotics and plant-based digestive enzymes to try and strengthen the health of the gut. I will also use raw goat's milk and kefir as foods that actually nourish the gut as well. And many of my colleagues and myself have often found bovine colostrum another important component of healthy gut immune system. And again, since the gut is the gateway to the immune system and the rest of the body, it's critical that we strengthen the health of that important local immune system. Now, I want to touch bases on what the cancer perspective is. In other words, what conventional medicine views as the cancer process versus a more holistic approach. Conventional medicine looks at cancer if it occurs at a local spot where cancer cells have gotten out of control and are reproducing. It views that the best way to treat this is with surgery with really good margins, strong chemotherapies and radiation, so that we eradicate cancer cells so they don't spread to the rest of the body. The holistic perspective actually looks at as cancer as a whole body process. In other words, the whole body participates in the tendency to develop cancer. Even localized skin growths like warts and skin tags and fatty tumors all represent a cancer tendency of the whole body. And it's actually a defense strategy of the body to push to the outside and away from vital organs that tendency to tumor development. So one of the worst things that I see that often clients mistakenly actually do is they have these localized growths removed. And that sets the groundwork for that whole body tendency to go deeper in the patient as a result of the suppression of the life force of the chi. And we'll often see that cancer will develop with new names at deeper organ systems. And again, so holistic veterinary medicine doesn't so much care about the diagnosis of cancer, but again, we want to use a strategy to treat that whole body tendency so that newer cancers with different labels don't develop in deeper organ systems. Now, if cancer does develop, there are very, very good arsenals of treatments that we have in holistic veterinary medicine. Homeopathy, classically practiced, which is based upon the choice of single remedies to put the body back into balance, is based upon the symptom totality of the patient, the mental, emotional, and physical symptom tendencies over the life of the patient that goes into the choice of a sequence of homeopathic remedies that help stimulate the life force in healing and, again, putting the body back into balance. Wonderful medicinal herbs and spices also play a role in the holistic management and prevention of cancer. Herbs such as astragalus and pau d'arco, burdock, spices such as oregano and ginger and garlic play a good role in preventing and treating cancer. There's also other supplements that come into play, such as moringa and dan quai. Again, very, very effective in preventing and being an important component of treatment of cancer. Medicinal mushrooms, such as ganoderma, shiitake, turkey tail, reishi, and cordyceps, are wonderful at stimulating the immune system and are direct cancer-fighting agents in our patients. Ozone therapy and high-dose intravenous vitamin C therapy are also wonderful treatments that more and more veterinary holistic practices are now offering throughout the country. And I wanted to bring to attention two newer cancer therapies that have been evaluated in recent years. One, known as neoplasine, is actually developed from an herbal developed from the bloodroot plant. Neoplasine actually is directly toxic to the kidney cells, to the cancer cells, and actually prevents spread of the cancer to other areas. Neoplasine can be applied either orally or topically or injected. And again, even the injectable and the oral form will travel in the body and actually help prevent and treat cancer that's even hidden that we don't even see yet. The only issue is that when it's applied locally, the cancer destruction often leaves a wide wound that the body has to heal. And I'm still concerned that sometimes this therapy will damage healthy cells in the area. But again, it's a new emerging cancer treatment that, again, many holistic practices are now offering. And finally, there's a treatment known as mistletoe treatment, and that's derived from the mistletoe plant. This form of cancer therapy has been used for decades in Europe and is not only toxic to the cancer cells, but also prevents spread of cancer to other organs, as well as lessening side effects if, again, more traditional cancer therapies are used. Mistletoe treatment is given either subcutaneously under the skin or intravenously, and it's given 3 times a week until there's a reaction at the site of the injection or a slight fever develops. But again, this is another recent effective cancer treatment that holistic practices are now using. So in conclusion, conventional mode of treatment of cancer is an early diagnosis and treatment with more powerful agents and radiation techniques that actually hope to wipe out the cancer cells. And I didn't mention earlier that lymphoma, the number one cancer seen in our animal patients, the chemo protocol known as CHOP is actually the same one that I learned about several decades ago. And the survival rate of lymphoma is actually the same as it was when I was in veterinary school, meaning somewhere between 6 and 12 months. if an animal doesn't develop side effects before that period of time. Early prevention of cancer is still the best strategy that I can't stress enough to our animal guardians. Realizing that those puppy and kittenhood years with minimal vaccination, being mindful of hormonal stresses on the patient, making sure we minimize the use of flea and tick strong pesticides, all are most important in preventing cancer. My name is Dr. Michael Dym, and I'm a holistic veterinarian here in West Palm Beach, Florida. I offer in-person consultations to clients in the South Florida area, and I also offer phone consultations nationwide. Thank you very much.